Now, I know that you're actually not here to listen to me, we're here to listen to these guys, but if you will permit me one indulgence very quickly, I'd love to touch on our heat and health paper because, as Nick says, my policy team has been working very hard on this the last couple of months, especially our policy officer, Laura Cameron, who's sitting at the back there. And through this, we talked to a whole range of stakeholders about people's experience about heat in the public sphere and how it impacts on their health and their ability to engage in everyday life. And today we released our draft consultation. It's up on our website. You'll also get it via email. And it's there for consultation. So I invite everybody to go and have a read of it. Let us know what you think. Are we missing things? Are we not missing things? I will take all of your good feedback. Laura will take all the criticism. Or the critical feedback, not the criticism, sorry. If there's anything to change. And so through this, one of the themes that came through our consultation really strongly was the wide spectrum of influences that heat can have on health. I mean, we have the almost immediate impact of heat stress. That's a good starting point. But then we also need to consider the compounding influences, like the effects on older people or those living with chronic illnesses. And then also the impacts long-term about influencing people's decisions about whether to exercise, whether to take public transport and things like that. So Ollie, your Heat and Health Research Centre has done a really wide breadth of research in this area. Would you be able to give us a high-level overview of some of the health impacts that have really stood out to you?
Sure. Thanks, Lauren, and thanks for the opportunity to be part of this panel today. So at the Heat and Health Research Centre at the University of Sydney, what we're looking at is the way in which extreme heat and hot weather impact human health and well-being across the entire human lifespan. And one of the things that I think goes often unnoticed is how different those impacts are depending on where you are in that lifespan. So very briefly, we know that extreme heat exposure during pregnancy increases the risk of stillbirth and premature deliveries. In early stages of life, differences in body sizes and physiology affects the abilities of kids to keep cool on very hot days when they're playing sport or in the playground. When we go into occupational sectors, there's a lot of heat exposure and people are more vulnerable if they have chronic diseases. And as we get into later in life, there are age-related reductions in the ability to keep cool because simply our ability to sweat is compromised with primary aging. And then that gets compounded further if we're taking certain types of medication or if we have cardiovascular disease. So it's really kind of a complex problem that we're really trying to deal with. And what we're trying to do is really embrace multidisciplinarity because we need to develop comprehensive solutions to these wickedly complex problems. And we can't just do that from one perspective.
I'd like to pick up a bit on that heat and sport and exercise point that you touched on there. And that was one of the things that came up for us a lot in our consultation. I guess one of the main things was if we just address climate change and fix inequality, it'll all be fine. But the overlay between social disadvantage and also then sport and access to exercise and things like that was quite frequently came up. And getting the community moving for the health benefits is a large part of your day-to-day, David. Why do you think it's important that physical inactivity is still addressed, even when heat, access, inequality are also factors?
Thanks, Lauren. Great to be here. And if I'm sitting a bit awkwardly, I only got back from holiday last night into my apartment, and that horrible moment when your suits don't fit. So I've just cobbled something together. So I'm feeling a little bit awkward here, but I'm here anyway.
You're looking good, don't worry.
Thank you, thank you. Yes, sport, physical activity, movement. It's, it can tackle a lot of, it's widely accepted that it can tackle a lot of social outcomes, but, it can definitely reduce chronic disease and improve people's mental health. And, we've talked a bit about preventative health today and social prescribing, but I've not really heard a lot about, sport and moving and getting people active. And, I think it's not a silver bullet, but it can surely go a long way. So we need to get people moving. And I really like that you brought it to inequalities, because, you know, we've got we're pretty good now around strategies to, you know, when it gets hot, we've got heat policies for sports, you know, we have water buckets, you know, we have sun-safe, you know, for people to participate, which is great. But it's those underserved communities that we don't reach, and we've talked a bit about social determinants of health. So we need to look at how we tackle and reach those groups. In fact, Penrith City Council gave me my first job when I came to Australia, so it's really nice to be back here, and I was actually managing the Penrith Swimming Centre across the road over here, and one of the things that they did is they opened up the facility for the homeless to come in on a Thursday, and I think that's just a really good example of things that you can do to support more vulnerable communities. And having worked at other councils, I've tried to do that, but that policy has not got going. So I think when we can try and branch out a bit to move away from the experience of leisure to more the experience of human needs, and trying to support them with the heat challenges is a way to go.
That's a great point. And of course, when it heats up, people tend to head for the water as well, which is good from a physical activity perspective, but also keeping people cool in general. Leanne, you've been working on getting people access to this. Where have you been seeing successes in this space?
Look, I guess initially we started working with the Parramatta River Catchment Group quite some time ago. They had set out a vision for swimming in the Parramatta River, and Sydney Water obviously carries a lot of technical expertise that's enabled them to realise that vision for swimming. But back in 2022, we realised that while we were focusing on Parramatta specifically, we should really be doing this everywhere. And so we set up a little program called Urban Plunge. And we've been working now with partners all across Sydney. And really the program was about, we know people living on the coast have access to these swimming opportunities all the time. That was really highlighted, particularly during the COVID pandemic when people were locked down and you saw all those people still having access to the beach. But what we've obviously seen most recently with the opening of Bondi is there's huge demand in Western Sydney for this kind of facility as well, and multiple facilities. Western Sydney's a really big place. So we are now working with a range of partners across Western Sydney as well, who are really showing appetite to look at swimming in local waterways, much more so than I guess they had previously, seeing other examples of it opening in Sydney.
Those sound great. Something that was often mentioned, or that we found in our consultation, is that people love to attend these pop-ups and these activations, when it's warm or when it's hot. But when it gets really, really hot, people tend to bunker down and stay, shelter in place, I guess you could say. And older residents in particular were mentioned as part of this. Ollie, I know that you led a big project in this space. What would you say are the key factors for keeping older adults well during a heat wave?
Yeah, so what we know from the epidemiological literature is that if you're older than 65 years old, but particularly over the age of 75, your risk of being hospitalized or even dying in an extreme heat event is much, much greater. And that's then aggravated by other factors. Now, I'm keeping an eye on some of the Slido questions that are coming through, and I know that we'll get to them later on, but one of the things I saw pop up earlier on is this idea of how do you get messaging to the most vulnerable. And so we're working with public health organizations such as New South Wales Health to try to ensure that the public health messaging around heat protection advice is informed by the latest scientific evidence, which has been generated by our research program. But you can have the best messaging, but you still need to figure out a way of actually reaching the most vulnerable. So we're working on a couple of things. We recently conducted a project called the Heat Watch project, which is a web tool or app that we've developed, which enables people to enter a profile. It's freely available to everybody. And you enter your individual information with respect to how old you are, whether you're on certain types of medication. There's GPS, so it knows where you live through your phone. And then it will give you a personalized heat stress risk assessment. And what we do also is give forecasting information so people understand when the highest risk is for them. And it's not necessarily just the highest temperature. It's humidity, it's wind, it's solar radiation, and all of these 4 factors combine to an individual heat stress risk. And the individual heat stress risk for everybody in this room right now will be different, even if for all the same conditions, environmental conditions, on account of the fact of our physiology, things like aging, medication, disease. So we use this tool to enable people to understand what their individual risk is. And we also use it as a platform to push evidence-based messaging to ensure that people can increase their personal level heat resilience. Now, we're not just trying to push this onto the individual as an individual responsibility. I think that's come up in a couple of the talks today already. We're also wanting to work, or are working with some organizations to use this tool as a means of identifying where the risk hotspots will be. And it's not necessarily the places that have the highest temperature. It's if we can weight the environmental conditions with the density of population with higher rates of obesity, for example, or cardiovascular disease, or an older population, people who don't have access to air conditioning. This is where we can really use this information to provide pop-up cooling hubs, for example, to help the most vulnerable.
When we talked to you during our consultation, Laura and I were actually floored by this tool. We've been talking about it ever since, and about different ways that it should be or could be integrated, and we keep getting surprised by it. Outside of extreme heat waves, we've heard that targeting on this panel and throughout the day, that targeting specific groups is particularly important. David, when you're putting together programs to address these issues, what are the sort of things that you would consider when trying to target specific groups, especially, say, the population of older adults?
Thank you. I just want to touch on one point from Lauren around this waterways and Penrith Beach. They're great, but there's sometimes unintended consequences from that, in terms of we need to be more diligent around, or vigilant around, drownings, because we know that 2/3 of drownings are from multicultural communities, so there's some education to that as well. I think it's listening, Lauren, and co-design, and we talk about these words, but an example of that is in Mount Druitt, where we're working with the Pacifica community we've designed a culturally responsive physical activity program, and what the Pacifica community told us was that if we could target their mums, then they have the biggest impact in that community, because everything kind of goes through there. So working with them, listening, having an instructor that is from their community, and being able to provide equipment, have a great venue we've got over there in Mount Druitt, that's one way we kind of do it. But I think seniors is another big one, particularly when it's hot. Bringing them to community centres and doing activities with them, because we need to kind of support our most vulnerable when we've got that heat. And the last thing I'll just mention is that, I was speaking to Mission Australia about this yesterday, about their tenants and getting them active. And for some of them, it's just survival mode. It's about the food and their shelter, and so it's about building the relationships with them to try and then introduce physical activity and movement to them as a secondary.
Lauren, can I just add something?
Yeah, of course.
In relation to the drowning risk, because I noticed there's another question on here about...
That's what I was just about to bring up, actually.
Yeah, about challenges in opening swim sites. And one of the things we most often hear... So Sydney Water does not own or manage these swim sites. They're usually run or operated by a council or another landowner. And one of the biggest challenges we hear from those councils is they're frightened of managing the risk, or the risks that are associated with drowning. I think what's interesting is on the beaches, we accept to some level that people drown from time to time. But because we don't swim in our natural waterways so commonly out here, councils are often frightened to pursue these opportunities. So I would say, yes, I agree, that is a big risk, and particularly being able to communicate to those culturally diverse communities those risks. We've been doing a lot of work with Royal Lifesaving New South Wales to try and address some of those issues. And obviously all those sites that we're looking at are very specific and very different in nature. But it's definitely a key consideration in terms of being able to open a site, managing those risks.
Can I just ask one thing? In Australia, we have, we have lots of pools. In Europe, we have town squares where people get together. But in Australia, we've got swimming pools, which are great places to connect and gather and for people to be active. Swimming pools are managed in-house, half of them, and the other half are managed by operators. On these big hot weather days, when it's really hot, they're great places to bring people to cool down. But for an operator's point of view, that's when they make all their money, because them are the bumper days. So it's really a cost issue for councils as well, who kind of picks up that cost for when people use these facilities.
Lauren, I'm just going to quickly jump in just for an additional perspective. So I appreciate the appeal of water facilities, but I think one thing to really keep in mind when we're thinking about the most vulnerable to extreme heat, they're people that are typically socially isolated. They're typically people who are immobile. They can't leave their house. There's a question about US cooling hubs. So these are pop-up cooling hubs that people can go to, and there's many of them in the US. The trouble is that people, the most vulnerable, can't get to these centers, and they can't get to these types of facilities. So while these solutions are very good for a certain segment of the population, we do need to keep in mind that the most vulnerable, the title of this session is the silent killer. Yeah. And typically, the reason that it's not fully understood, the impact, is because the biggest impacts happen out of the gaze of the public. These are people who are socially isolated at home and are found dead days later, if not weeks later.
And that was actually, I keep saying this, but that was something that came up quite a lot in our consultation, and especially around hot public transport and being able to get to and from, and then sometimes it's not that great going to a cooling refuge when you get hot as soon as you walk outside, and then you've got to walk home and it doesn't matter so much. Just kind of tacking on to the end of that, I saw there was a Slido question on here that I've lost now, but it was about increasing humidity in the climate, and I think that over the last couple of months, we've seen a couple of articles about how the more tropical sort of weather is coming down through Sydney. Is that a consideration for us in the future, Ollie?
So one thing that's is really important for people to understand. So when we see the temperature that is on a weather forecast or on a weather report, that's measured in the shade. So if you're out in Penrith and it's 48 degrees Celsius in the shade and it's a sunny day in the middle of the summer, in the sun it's above 60 degrees Celsius. So that's one thing. The other thing that really aggravates heat stress is humidity. And the reason for that is that the only way in which we can physiologically keep cool when we're exposed to temperatures higher than 35 degrees Celsius is by sweating, but it's not the production of sweat that cools us down, it's the evaporation of sweat. And the thing that blocks the evaporation of sweat is humidity. So if you see sweat on your skin glistening, it's not doing anything, it's just sitting there, not cooling you down. So this is why humidity really matters. So there's been a lot of work that's been done in the last 10, 15 years looking at something called wet bulb temperature. And there's been theory that the maximum wet bulb temperature, which takes into account the effects of temperature and humidity, is 35 degrees Celsius. Once we reach this threshold, we can't keep cool. Within 6 hours, we would all die of heat stroke. So ourselves and some collaborators from the US have implemented or integrated human physiology into these projections. And unfortunately, the news is far worse, because when you take into account there are limitations to the ability to maintain heart rate at a suppressed and safe level, there are limitations on how much you're actually able to sweat, these critical conditions are actually cooler and less humid in the future. So conditions that we thought we were going to see with climate change that wouldn't threaten human life are actually seem to do so. So I think that's something that we really need to keep in mind. It's not just the temperature. We need to think about these other environmental conditions that define how extreme heat impacts human health.
And looking to the future still, there's a question in here about the experience of heat in summer, making outdoors intolerable. Leanne, I know that Sydney Water is looking in around the aspects of smart temperature sensing and smart irrigation and some things around that. Could you tell us a little bit about what the future might look like in that sort of space?
Yeah, so look, it's in a separate team to me, but we have got a team looking at the benefits of smarter technologies, I guess, in terms of smart irrigation. So they've got some sensors set up in various council areas across Sydney, and looking at the role technology plays in being able to irrigate our parks and green spaces more effectively, to provide that kind of evapotranspiration and cooling effect that helps people as they experience the heat in the environment. So if anyone's interested in that, I can certainly take a question on notice and take that back to that team member. But I guess what we're really trying to explore here is a range of opportunities, you know, to kind of shift what our places look like and what the environment looks like through the services we're able to provide at Sydney Water and the role that water plays in that space.
I've got another question from Slido here around children and young people in schools, and how we tend to minimise the school children's experiences of heat. David, through your programs and things like that, what is your experience of children being physically active and their experiences of heat, and how do you look to mitigate that?
It's a good question. Well, I think it's around education, you know, sun safe, making sure that they've got the right equipment. There's lots of breaks. If you're playing games, it's not halves, it's quarters. You know, there's plenty of shading area when people have breaks. You know, hydration. You know, it's simple things really that can go a long way. And obviously, education to parents and schools. So that them are the main things there. Yeah.
Yeah.
Can I just quickly jump in?
I was about to ask you anyway.
One thing that we do, so we partnered with Sports Medicine Australia, who have the responsibility of regulating heat stress policies for a lot of sports across Australia, including kids' sports. And so we developed a tool that really speaks to the interventions, but also the risk, heat stress risk assessment for everybody, including kids. And we've now implemented that into a web tool, which is available to everybody. So if you go to Google and you put SMA heat policy tool in Sydney or something like that, I can't remember the exact URL, but you'll have there's a free tool that anybody can use, and it's just as good for school kids as it is for adults. And it enables people to be prepared for these types of circumstances. Because I think what a lot of people find is that if they're caught on their heels because it's a hot day and they're not prepared, then you need certain resources and facilities to be in place to ensure that kids can continue to be active, but in a safe way despite the hot weather.
Not to plug the discussion paper again, but we did actually link it in there. So you can also find it there. You can find it in two places, or both things in one place. So there's a couple of other Slido questions coming through for you, Leanne, and one of them is whether you could tell us any of the other ways that Sydney Water is pursuing to help ease the experience of heat.
So some of you in the room might be aware that another part of my team is involved in developing the largest stormwater scheme for Western Sydney. So it's Sydney Water stepping into stormwater in a way that I guess it hasn't traditionally done, allowing us to look at a much more integrated approach to how water is managed and delivered in a growing population in Western Sydney, and try and do things a bit differently. And that will involve actually having a lot of green space that's owned by Sydney Water, that is not only available to host wetlands and treat water in the environment, but also provide that kind of green and cooling space for the communities to enjoy. So we're starting to think a little bit differently in terms of how we deliver infrastructure away from what we've traditionally done, which is kind of water in and then water out of your bathrooms. So just taking a much more integrated approach to how we consider the water cycle and the role we play in that.
That sounds great. I look forward to it. I think, well, we don't have too much more time, but I did want to maybe unpack a little bit around the place-based / person-based programs versus kind of those broad brush but also highly accessible ways of targeting people, either through programs or through through messaging to the community. David, where do you see the benefit in that, working within the community, that person-based, place-based sort of interventions?
Yeah, I'd love to just broaden that discussion a little bit to something that we've been working on for about 2.5 years is an initiative called Western Sydney Moving, which is a whole-of-system initiative to reduce inactivity and inequalities within Western Sydney, working across the 13 local councils and PHNs and local health districts and academia and disability and etc. And what we're trying to do there is bring a coalition together to look at how we get more people active. And we will be launching that as a health promotion charity at Combank Stadium on the 21st of November, which is really exciting. And listening to the Minister today, Minister Park, say we need to think about things outside the box. Well, there's a lot of initiatives already out there already, a lot of great community organisations, but how can we work with the system that we've got to lead, connect it and support it to get more people active? So within this project, we're setting up local active partnerships within each of the local areas to work from a place-based approach to see how we get more people active. And working across the system, and heat obviously is a part of that.
And Ollie, on the other side with your platforms and those sort of information, or improving the information accessibility, where do you see the particular wins with that? And is there a crossover with the person-based programs that you can see or that you are already seeing?
Yeah, so it's still a work in progress, and I think the first step is really designing these tools in a way in which we know that they resonate with what the user is going to want. So just back to that Heat Watch project that I mentioned earlier on, a key component of that was ensuring that we didn't just design it in a way that we thought would make sense to people. We co-designed it with nearly over 150 people to get a sense of what makes sense to them. And no shock, it looks completely different to the way I would have it. But it's not made for me, it's made for them. So that's a really important component. But the next step is then going to be doing clinical trials where we can actually identify the impact of these different types of tools on health outcomes, but also behavior as well. So a key question right now is how much is extreme heat a barrier to physical activity, not just in the sports space, but also in the incidental physical activity space as part of a obesity management plan or a chronic disease management plan. So there's lots of different areas that we can expand to with that.
Yeah. Well, that is all the time that we have today. Could everybody please join me in thanking our wonderful panelists? Thanks, guys. I now have the pleasure of introducing our next panel. The chairs of our 3 LHDs, Honourable Peter Collins from Nepean Blue Mountains, Loretta Demento from Western Sydney, and Sonia Stewart from Southwestern Sydney, and their Provocateur Chairman of the Dialogue, Christopher Brown.